Welcome, everyone, to this edition of the Healthcare Labyrinth Podcast. My name is Marc Ryan, and it's a pleasure to be hosting this podcast, and thanks to everyone for listening in. As I always do, I will start out with a little overview of the Healthcare Labyrinth website. So on that website, we have three different kinds of things. One, a weekday daily news feed where I summarize and have some commentary on the news of the day. That's posted under the news feed tab. Number two, we publish 2 blogs a week on various topics, and that's at the blog tab. And number 3, our podcast, of course, is posted on the Healthcare Labyrinth website and is also on major podcast websites and applications. So go to healthcarelabyrinth.com to read up on all of the healthcare news of the day each day. Also, at healthcarelabyrinth.com, you can purchase my book, The Healthcare Labyrinth, and you'll get all the details there about how to purchase it. There are 3 media in which it's published, print book, of course, and then ebook and audiobook. With that brief overview of the Healthcare Labyrinth website, we're going to get to the topic of this week's podcast, which is the Medicare Advantage 2024 open enrollment season, as well as growth from January 23 to January 24. What I often do, actually every year I do it, so it's sort of an annual exercise for me, is I will do a Medicare Advantage MA enrollment growth assessment. I usually write and blog about this and do a podcast about it after we receive the results of the MA open enrollment season that ended on December 7th of the previous year. So sometime in mid-January, I talk and write about MA enrollment. And as everybody knows, the so-called open enrollment season, it's actually called the annual enrollment, but colloquially we call it the open enrollment season, runs from October 15th to December 7th. There's about an 8 or so week sprint where all of the MA plans, the marketing agents employed by MA, and brokers are out there enrolling seniors and the disabled into MA plans for the coming year. Sometimes they enroll a little bit earlier if they have a special election period available to them. But that is where that October 15th to December 7th season, that rough 8 weeks, is where, MA really sets itself up for what it's going to make in the succeeding year. And it's obviously a very, very important time. Now, given some other enrollment periods we'll talk about as well, and just generally the growth and aging of America and eligibility, MA plans today tend to grow fairly enormously throughout the year. There's no question about it. And with the penetration of special needs plans that we'll also talk about, it tends to grow, again, even more throughout the year. But that open enrollment season, October 15th to December 7th, remains a critical part of growth for MA plans. So this is my assessment of what happened from January 2023 to January of 2024. I'm also going to give you some stats about what happened during the enrollment season, but to me, the best way to calibrate what's happening in the MA world is to compare January to January of each year. So in a rough sense, there are some MA health plans that are singing the blues after what could be called a lackluster MA enrollment season for them. There are some folks that did extraordinarily well during the open enrollment season, October 15th to December 7th, 2023, for 1/1 enrollments usually. But again, some had some disappointing news throughout the year, or in the enrollment season that was actually tied to, as I point out, financial decisions as well as poor STAR scores and things like that. So a few key points about the enrollment big picture here. And again, you can go to my blog, published January 22nd to see some charts and things like that as well. So MA has grown explosively this decade. It's really rather phenomenal. I've sort of begun tracking this back to January 2020, every month from there now to January 2024. So that's really 4 open enrollment seasons, 4 annual periods that we can look at. And again, explosive growth this decade. Enrollment is now up about 9.5 million lives since January 2020. That's almost just a hair shy of 40% in just 4 years. So as of January 2024, enrollment in MA now stands at almost 33.5 million lives. It's 33.472 million. MA has hit, as I've talked about in other blogs and podcasts, that critical 50% of Medicare beneficiary enrollment. Now, why is that so important? Well, a couple of reasons. That benchmark really shows how important Medicare Advantage is to the future of Medicare and the value it brings to consumers. From a political sense, when you're a majority of enrollees, number one, it shows how important that program is. But number two, it also puts a little bit of a target on people's back, meaning the MA plan's back. And as we've talked about, despite the popularity, bipartisan popularity within Congress, Medicare Advantage is being scrutinized for things like overpayments, the STAR program, risk adjustment processes done by plans that many people say leads to over reimbursement. So again, it's harder for Capitol Hill and lawmakers to really take a huge knife to the program when you're a majority of enrollees because of constituent backlash. But at the same time, it also will shine more of a light on the program and potential changes there in the future. So a little bit of a good and bad there, reaching 50%. The fact is that MA really reached that 50% mark much earlier than many thought it would. Private and public estimates suggested that maybe we would hit that 50% mark sometime in 2025 or so. Well, we clearly hit it at least a year earlier. We really sort of hit it sometime in the second half of 2023. I would estimate some said it was a little earlier, but nonetheless, we reached that point a lot quicker. So enrollment growth in both raw numbers and percentage slipped from January 22 to January 23. So last annual cycle, it was down a bit. And many people predicted that we would see not great year over year, 23 January to January 24 numbers. But I'm really pleased to say after my analysis of the data that the numbers show a great rebound in both a numbers perspective, the sheer number of people that enrolled from January 23 to January 24, as well as a percentage growth number. And we'll get a little more into that. But again, that was unexpected by many observers out there. Overall, many projected additional slowdowns given, overall penetration since 2020 within MA. Some concerns about the changing risk profile that we see in the program, and also about lower rates and poor star ratings that generated lower star bonus revenue. It did mean a partial pullback on supplemental benefits to some degree, but by and large, things look very good and benefits stayed pretty strong. And it did lead to a pullback by some plans because of profitability issues. But again, overall, the industry really performed rather amazingly. We do know that MA is becoming highly penetrated in the large metropolitan areas. We are seeing penetration rates well over 50%, going to 2/3 and even higher, depending on that market. That tends to restrict net new growth in those regions. So you're sort of trading lives between health plans at that point. However, MA plans seem to be growing really well, and we'll cover this in more detail in the more suburban and even some rural areas. And that's because of the growth of preferred provider organizations. And we'll talk a little more about the difference between PPOs and HMOs. So a lot of this growth is driven by PPO products and some growth in regions of the nation that typically did not see as great growth over time. So that's really the summary. We're at over 50% of MA as a percentage of overall Medicare beneficiaries served. We've seen about a 40% growth rate from January 20 to January 2024. The enrollment now stands at 33.47 million when it was under 24 million lives back in January 2020. Just an amazing success story for MA over the last 4 years. Let's get a little into why Medicare Advantage is so attractive. Well, it really is for a couple reasons, and I've touched on some of them already. It really does have a huge advantage over traditional fee-for-service, and thus it's very appealing to Medicare enrollees. Despite some criticism that you'll hear largely from political critics and providers in the area of prior authorization and claim denials and things like that, it's very clear based on the numbers alone that members are highly satisfied with MA and the supplemental benefits and the out-of-pocket protections that MA brings. So despite some lower rate increases, again, MA plans have been able to keep sustained and even growing value for Medicare beneficiaries. They've been able to increase benefits and make products very appealing over the past several years. And how do they do that? Well, number one, as I often talk about, the MA rate setting system largely is based on the antiquated and inefficient fee-for-service program costs. It doesn't mean that MA isn't reimbursed below that, but if you base your rate setting on a very inflationary fee-for-service program, you tend over time to have a really good rate system, even with some lower rate trends recently in the program. This allows plans to deliver the base services because they're far more efficient below the fee-for-service costs, and in some cases substantially below. And you then pass the savings on to members because you're still granted those dollars. And the federal government tells you that anything below delivery of base Medicare benefits to the amount you're receiving in the rate has to go through in additional benefits to the member. So that creates immediate value. And that benefit pass-through mandate is sort of a good thing about why MA has grown. So plans do a variety of things with that money to provide value to MA enrollees. Number one, they reduce traditional program cost sharing. So where you have roughly the 80-20 rule pretty much throughout the fee-for-service program, MA plans essentially buy down that 20%, oftentimes down to zero in the case of maybe even a primary care visit. MA plans also fill in the huge fee-for-service benefit gaps. And what do we mean by that? Well, good example, the inpatient benefit. The inpatient benefit has a cap on covered days, and it has very, very high cost sharing and essentially escalating cost sharing for the more days you're in the hospital. And that has the tendency to often bankrupt seniors and the disabled if they have one or two bad inpatient stays during a given annual period. So what the plans do is they will buy that down. They will essentially provide a whole year's worth of benefit in inpatient to protect members, and they may have fairly modest, in comparison to fee-for-service, copays per day and cap those copay costs per inpatient visit. So that's one good example of how they fill the huge fee-for-service program benefit gap. Another way they do that is through numerous supplemental benefits. We know that by and large, the fee-for-service program does not have dental and vision and hearing benefits and things like that. So most of the MA plans offer dental, vision, and hearing. And they also offer other innovative benefits that help particularly low income or lower middle class income, fixed income seniors and the disabled. So they will offer supplemental OTC benefits. They will offer cards that allow you to use dollars for groceries and even rent. And they also offer some now innovative programs where they're paying for home improvements and even custodial care type services, which are not generally covered within the Medicare program, but it helps keep people in the community and it helps keep people healthy. And I really applaud CMS for allowing the massive expansion of supplemental benefits over the years in roughly 3 types of categories. It has not only attracted seniors, but I think over time, it's going to show how beneficial allowing MA plans to cover these kind of non-Medicare benefits to seniors along the way. It really will show how they stay healthy and in the community and essentially lower cost for a longer period of time. CMS also created the Star Quality Bonus Program, which rewards high-performing plans with additional revenue, even beyond the rate-setting process we talked about. And again, those bonus dollars need to be used for additional benefits. So plans scoring 4-star and greater get an additional 5% bonus in revenue, which allows them to, improve benefits even more. And we're really seeing seniors and the disabled gravitate to these very high-performing plans. They've become very savvy in how to choose plans. So that's an important point, too. And lastly, I'll also point out, despite all of the ugly headlines over claim denials and PAs, which in my mind are really fairly minor, and they cut waste in the program, MA plans also improve outcomes by teaming up these additional benefits with services that traditional enrollees don't get. That traditional enrollee is really in a system that is very opaque and complex, and I would argue labyrinthian, as my book title suggests. And especially if you have social determinant of health barriers, navigating that system is almost impossible. You're really very much on your own, and you don't quite know how to navigate that system to get the best health care. Well, MA plans provide critical case and disease management services, as an example, or in the special needs plan program, case management and care management is even more involved and more hands-on. So these kind of services also help seniors navigate the system and have better overall health outcomes. So the combination of the benefits and the quality focus make for a really great value proposition for MA. As I often say, MA has become one of the greatest social safety nets for lower and lower middle income seniors. What do I mean by that? Well, if you were in the traditional fee-for-service program, the amount that you would outlay in costs for health care between cost sharing and gaps in the program and for your dental, vision, and hearing coverage would be so much greater. And what MA does is it buy downs those costs, protects seniors, and it really means hundreds and sometimes thousands of dollars a year in additional support for these fixed income Americans. So the value proposition really means members flock to MA. We see that in the data I just talked about. And again, those savvy Medicare beneficiaries are flocking to the highest performing plans for the quality they offer, as well as the even better benefits as well. So that's just sort of a very quick overview of why MA is attractive to seniors and the disabled in the program. So let's get to some of my analysis approach and parameters. What did I do to sort of come up with some of these findings? Well, I analyzed the January 2023 and January 2024 enrollment spreadsheets posted by the Centers for Medicare and Medicaid Services, known as CMS. I looked at all MA enrollment. A word of caution here, while the open enrollment season has ended as of December 7th, 2023, you will continue to see increases in the next several months. Some may have signed up too late for January 1 enrollment. There also is an additional enrollment period for some enrollees that occurs from January 1 to March 31st. Not for everybody, and what you can do in that period is limited. But given the fact that ongoing marketing by plans continues in that January to March period, this tends to increase MA numbers too, with new people coming into the program being aware of MA versus traditional fee-for-service. So my analysis was really focused on overall MA membership growth, as well as big national enrollment plans and select prominent startups. Some of them we call insurtechs in the MA world. And so I derived the trends from this analysis. The plans that I reviewed, let's talk about the big national plans first. So I looked at United Health Group, Humana, CVS Aetna, Elevance Health, Kaiser Health Plans, Centene, Cigna, Healthcare Services Corp., and Molina Healthcare. For the prominent startups, I looked at Alignment Healthcare, Bright Health, Clover Health, and Devoted Health. I did not look at standalone Part D plans because they are not full Medicare plans. I just looked at those MA plans. And the types I looked at, and this is a fairly broad encompassing of all MA plans, were the local health maintenance organizations known as HMOs, the local HMO point of service plans that have some out-of-network coverage known as POS plans, local preferred provider organizations, which are PPOs. I looked at the regional PPOs that aren't just based on county, but larger regions of a state or between states even. Medicare, Medicaid HMOs, which are the pilot program that is being phased out, where you contract with state Medicaid and Medicare together if you're a health plan. Private fee-for-service plans, which are really an old program that's sort of waning. 1833 and 1876 cost plans, again, some older pilots that are still out there, but small enrollment. Medicare medical savings account plans, a new type of MA that is out there, but has only garnered very small enrollment. And then lastly, the program of all-inclusive care for the elderly organizations, the PACE programs, have been sort of put under the rubric of MA as well. They are fairly small enrollment as well, but have very complex long-term care need individuals in that program, and they're largely both Medicare and Medicaid eligible. So let's talk a little more about the MA enrollment growth main findings. So again, I'm going to repeat a little about what I did earlier, but basically, again, to reiterate, we saw MA membership grow from 30.799 million in January of 23 to 33.473 million in January 2024. That's an increase of about 2.67 million year over year. That year over year percentage increase was 8.68%, which is up from 6.12% from 22 to 23. So again, that rebound I talked about. Big MA plan enrollment, which were those firms that I talked about a little bit earlier, it rose from 23.456 million in January 23 to 25.565 million. So an increase of about 2.1 million or 8.99% in January 2024. Big Plan MA enrollment represents over 3/4 of all enrollment in MA. It's about 76.16% as of January 2023, and it grew to 76.37% as of January 2024. So it was up slightly. And that tends to be, that 3/4 statistic tends to be about right. It's increasing a little bit every year. Big Plan MA is just under 3% of all sponsoring organizations, the so-called parent plans, but they represent about 79% of growth from January 23 to January 24, similar to the statistic that they represent 3/4 of all enrollees. So that's also consistent with what we see out there in the past several years. Let's talk a little bit about the big MA players here and how they performed. And as I alluded to, there's a little bit of a mixed bag out there. So United Health Group has consistently outperformed national players over the years. Year over year, United banked the biggest gain in membership overall, almost 802,000 members and a great 2% growth rate. But it did not fare too well during the enrollment season proper. Most of its gains occurred from January to October of 2023, about 613,000 members. It gained about 189,000 members during the enrollment season. Still, its marketing and branding agreement with AARP pays huge dividends, and I still call it the granddaddy of MA and the granddaddy of insurers throughout the country overall. Humana had a similar story year over year as United. It is the second biggest player in MA behind United. It had an impressive year over year, January 23 to January 24. It grew by about 635,000 members, or 11.7%. Again, impressive for Humana. But again, most of its growth came between January and October 2023, about 492,000. Just 143,000 came in the enrollment season. So that led to some disappointment at its recent Q4 investor call, in addition to some medical expense issues. United had some medical expense issues as well, but overall, United and Humana as the biggest players, if you look at it year over year, they remain powerhouses and probably the best run programs out there on a continuum basis. Let's talk about Aetna, which is part of CVS Health. It probably could be given sort of the award for the best growth of 23 to 24. It did tremendously well, a huge turnaround for CVS Health and Aetna. It gained a whopping 772,000 lives from January 23 to January 2024. And that was about a 25% gain for CVS Aetna. About 257,000 of those gains were from January to October, but a huge 515,000 lives came in the 8-week enrollment season. And that certainly rivaled what United and Humana were able to do throughout the year. And it certainly was just an amazing enrollment season performance for Aetna CVS. After a good 22 to 23, Elevance Health remained basically flat from 23 to 24, losing about 10,000 lives. So that was a fairly big disappointment for Elevance. Kaiser, too, sort of the fifth ranked in terms of enrollment, did pretty poorly, gaining just 47,000 lives, or 2.57% year over year January 23 to January 24. In the case of Centene, what we saw from 23 to 24 was a bit planned given some concerns about financial performance in the MA line and low star scores that they're seeing the last couple of years. So the company indicated that it was strategically going to shed some lives in 2023 and into 2024 in favor of profitability. So this was warned by the CEO some time back, and that is exactly what happened. Centene lives in MA declined in membership about 232,000 or about 17% from January 23 to January 24. About 77,000 of those lives were lost between January and October, and about 156,000 of those lives were shed in the enrollment season, largely because of pullback in benefits and in some geographic regions. So that Centene losses were pretty much known were going to be occurring. Cigna, the next largest, grew by about 7.75% year over year, or about 42,000 lives. HCSC, which is a big Midwest blue company in a number of states, had a good second year in a row. It's a pretty small player overall in MA, but again, it began its campaign to grow back in 22. It grew well 22 to 23 and 23 to 24. It had a 36.7% or 45,000 member increase from 22 to 23. It performed roughly the same from 23 to 24. It gained about 50,000 members and grew about 30%. So that's sort of a take on the big MA. The other big player, Molina, really didn't grow much from 23 to 24. So let's talk a little bit about the rest. The prominent startups had two standouts in terms of growth from January 23 to January 24. I always talk about the prominent startups or the insurtechs struggling to some degree, but some have a good profile and seem to be growing. Well, the two guys of the prominent startups that are doing well are Alignment Healthcare. It grew about 57,000 lives, or about 65% from 23 to 24. And Devoted Health is probably the best performer. It grew about 86,000 or 74% year over year. I would note that these prominent startups still represent just a small percentage of MA lives overall, which is perhaps disappointing to investors. The four I looked at represent just 1.6% in January 2024 of all MA lives. If you look at the non-big MA plan enrollment players, including those startups, they grew at a reasonably healthy pace year over year as well. They grew about 566,000 lives, or about 7.71%. Non-big MA enrollment dropped slightly to 23.63% of all MA enrollment. So again, we see slight erosion year over year as big MA national plans take a little more of overall MA enrollment and the increases year to year from the rest of the bunch. So how did SNP plans do? Well, let me tell you a little bit about SNP plans in case you haven't listened to earlier podcasts. Special needs plans are special plans set up by CMS that serves various hard-to-serve communities. There are roughly three types of SNP plans. The first is called a dual eligible SNP plan. That's called a DSNP. And these are targeted to individuals that are enrolled in both Medicare and Medicaid. They are either disabled or aged and meet Medicare, and usually that's primary, but they also have low income and meet requirements for Medicaid. So the two programs come together. And what special needs plans try to do is coordinate the Medicare and Medicaid funding for the benefit of the member to reduce costs, but also to drive quality. And many of these folks in DSNPs have huge social barriers to health. And so that's why these special need plans for dual eligibles were set up. And the DSNPs represent the lion's share of all SNP enrollment. The second SNP type is called a chronic care SNP or a C-SNP. And CMS allows health plans to come together and create these chronic care plans that are targeted for given disease states or perhaps a couple of disease states. So if you have diabetes or coronary artery disease or COPD or asthma, you can enroll in these plans that are targeted toward people with your disease state, and they're meant to drive outcomes. Again, they're much, much, much smaller than DSNPs. And the smallest enrollment category of special needs plans are what's known as institutional SNPs. And these I-SNPs essentially cater to individuals that are in institutions. They could be nursing homes, they could be assisted living facilities, or at risk of institutionalization. And so the idea here is, again, to coordinate with the institutional care setting in many cases, or community providers providing support for those individuals, and coordinate that service with the Medicare service to keep these folks at home. Oftentimes, those institutional services are funded by Medicaid as well. So SNPs are usually HMOs, but there are also some local PPOs that are SNPs. And again, the vast majority of enrollees are dual eligible SNP members. So SNPs have been growing phenomenally over the last couple of years. I told you that overall enrollment for MA from January 23 to January 24 was 8.68%, which was greater than the 6.12% from 22 to 23. Well, SNP plans alone during the 23 to 24 period grew to 6.9 million members, a gain of about 1.15 million or 20%. So whereas the overall MA lives are growing between 8 and 9%, SNP plans grew at about 20%. That has a double-edged sword here because it's great for plans to be investing in special needs plans, but it will also bring more scrutiny. The program audit regime and the quality mandates and focus are getting much, much greater. So you have to have acute attention to how you run your SNP plan, even beyond the tough audits and other quality regime in MA more broadly. So let's talk about where all of this MA growth came from in the last year. So let me start out by saying just briefly, given some concerns about financial performance and the growing risk in the program, the number of what we would think of as benefit plans, these are called plan benefit packages or PBPs, dropped a bit. So beginning in the 2020 and on for a couple of years, the number of new plan benefits increased rather dramatically along the way in both HMOs and PPOs. But we're now seeing a slight contraction in PBPs. So the number of plan benefits from January 23 to January 24 dropped from 7,347 to 7,264, a drop of about 83 plan benefit packages, or about 1.1% negative. Again, this is really tied to sort of a bit of a retrenching by some plans in the marketplace, given performance and risk. The number of sponsoring organizations remained about the same, dropping by 1 to 305. Again, the number of new entrants into MA is pulling back, similar to the PBPs. So where did the growth occur? So I tend to look at growth in what we think of as traditional HMO enrollment. and PPO, preferred provider organization enrollment, to determine some of these trends. So just very, very quickly for those not familiar with the term. So an HMO is sort of your standard managed care network product. You have a network, you largely have to remain in that network, except for some special cases within Medicare. And, it's your traditional HMO. Preferred provider organization products are slightly more expansive networks. So the networks are a bit bigger than what you would think of as an HMO. And they also have an element of out-of-network coverage that you can go to at higher cost sharing and still get it covered. So those are sort of the difference between HMOs and PPOs. They operate slightly differently in Medicare than they might in the commercial world, but nonetheless, tight, small HMO network, little out-of-network for HMOs, PPOs, larger networks, but also some out-of-network coverage. So why do I talk about this? Well, historically, HMOs have been very popular in MA for lower to lower middle income people on fixed budgets, and largely in more urban areas. And now what we are seeing is PPOs growing. Well, PPOs are growing in metro areas, and they are attracting higher wealth individuals, people above fixed incomes that want to have a little more choice perhaps in their doctor or in their network. But also more importantly, these PPOs are growing in more suburban and even rural areas. So the popularity of PPOs throughout the country, but especially in areas that were not traditionally served by MA, is really where a lot of growth is coming in this PPO world. So over the past several years, PPOs began growing and competed well with HMOs in terms of raw numbers as well as percentage growth. Now PPOs have really taken over above HMOs. So while HMOs continue to have the largest number of enrollees, HMOs grew year over year just 853,000 lives from January 23 to January 24 to about 18.76 million lives in January 24. Again, still has the most enrollment. But PPOs grew by 1.86 million lives to 14 point almost 4 million members in January 2024. So HMOs grew by about 4.76%, while PPOs grew by 14.84%. So a lot of this growth we're seeing is really in this PPO area, which is pretty extraordinary. Let's also look at plan benefit packages to see the difference between the growth in HMOs and PPOs. Well, I told you a few minutes ago that the overall number of plan benefit packages contracted in 24, which was not the case in several years earlier. Well, there is a slightly different trend in PBP growth between HMOs and PPOs. So let's look at January 23. MA plans created about 148 more HMO PBPs and 300 more PPO PBPs for the 2023 contract year. That's pretty impressive, right? HMOs continued to grow, but PPO plan design was roughly double what it was for HMOs. In 2024, we told you overall there was a contraction. Well, that contraction largely was HMO contraction. The number of HMO plan benefit designs contracted by 172 in 2024 for HMOs. But PPO plan benefit designs still grew by about 62. So you can see continuing investment, although at a lower level in 2024 in PPOs, with the contraction of HMO plan benefit designs. How do we think about all of this? Well, It's pretty simple. Sometimes you'll hear alarm bells, even from me, about what's happening in MA. And I do that deliberately to call attention in the industry to some bad trends, right? Whether it's prior authorization reform or poor star performance, I want to call that out. But in the end, MA remains a very attractive and stable and profitable area for insurers. The aging in America, reasonable reimbursement rates overall, whether we talk about the rate setting system or STAR, and the fact that we have an old and tired traditional fee-for-service system as a competitor makes MA really the place to be for insurers. And plans continue to make robust investments here. So we're going to have our ups and downs sometimes. We will see mixed performance between plans. Some plans continue to do extremely well. Others have missteps on STAR in other areas, including the open enrollment season. But by and large, overall, these statistics show us that the industry is strong, it remains growing, and it means a great value proposition for enrollees. And that will really continue to be the message in terms of enrollment moving forward. That value proposition of MA is driving all of this kind of growth, which ultimately, despite some parebacks that I expect in the future, will mean the program will, by and large, be safeguarded because of how many people rely on MA for their well-being each and every year. With that, we hope you enjoyed this look at enrollment in the MA program and the changes for January 2024. And we'll see you on the next Healthcare Labyrinth podcast. Take care.